So I say, welcome back, Sweden, to your Caribou Data Science channel. This is the afternoon of, what's it, Tuesday, March the 22nd. Let's just take a quick look here, Sweden, at some vaccine numbers here as a bonus for you folks today. So far, Sweden has administered 20.9 million doses. Of those doses, okay. Of those doses, 7.8 million have received the first shot, and 7.6 million have been fully vaccinated in Sweden, which gives a vaccination rate, first shot vaccination rate of 76.8%, and a full vaccination rate for Sweden of 74.8%. Okay? Now, since we're here, let's just come back over here. Location equals okay, good. So let's go over here. Let's do a okay. Sweden's numbers. Let's make sure this is actually a date. There we go. Oh yeah, let's do this. Repeating pattern. This is sort of interesting, isn't it? That's actually some interesting information, isn't it? Okay, very good. Okay, but nonetheless, let's come over here now, since we got a table. Okay, So that's going to be total deaths divided by total cases. All right? And that's also going to be a percentage. All right? So now let's come over here. Okay. So let's come over here now. Let's insert a pivot table. A new worksheet. All right, and let's do date. And let's take a look at mortality rate. Let's cover here then. Let's do insert. Okay. So this is mortality rate, or it should be mortality rate. So let's come up here now. Let's convert this to okay, this shouldn't be a sum in that case. Okay. So what we can see here is the average mortality rate by quarter for Sweden. Okay. Let's come down here now. We come all the way back up here then. You can see in Sweden, the mortality rate spiked all the way back over here in the second quarter 2021. This line here is 2%. Okay. What about if we change this to a different? Yes, there you can see for the first quarter 2022, your mortality rate is down to about 0.7%. This would be that sort of gives you a quick idea what's going on there. So now let's go ahead and run the regular numbers for Sweden. So this would be cases per capita So what this would be then, this would be the, okay, so let's come over here then. Let's insert another pivot table. All right, once again, we're going to use date. And we're going to do Can that really be right? Okay. The problem again is this. Somewhere last summer, you can see what happened here, at least according to my number. Now, some people say that's not the numbers to look at. But what you can see here, okay, so what you can see here is sometime around, August, mid-August, late August, they switched to a 4-day-a-week reporting cycle. Okay, for cases and deaths both. So anyway, let's take a look. So you can see Sweden's cases have already passed 2021 total cases, and Sweden's deaths have already passed 2021 deaths. And again, here, the gaps are the Saturday, Sunday, Monday, and Tuesday days, or Saturday, Sunday, and Monday and Tuesday, because the spikes are the total for Saturday, Sunday, Monday, and Tuesday. Okay, I don't understand what caused this gap right here. But it looks over here, if at first Sweden was starting to see a bit of a decline in cases, then it's kind of inching back up. So that's not necessarily a good sign. If you look at a 14-day moving average, you can see that for the previous 14 days, Sweden was averaging 1,853 cases per day. You can see that they had a big spike in deaths back in January and February, although these do appear to be falling now. So you can see here that currently Sweden is averaging 34.9 deaths per day. Weekly cases, nice big fall off, nice big declining pattern here. Weekly cases, deaths not quite as good. This could be the third week in a row we see a decline in COVID-19 deaths in Sweden. Monthly cases, okay, March is going to wind up being, the lowest number of cases in 3 months by far. And unfortunately, deaths for March are going to be the second March deaths for Sweden is going to be the second most deaths of any of the previous 12 months. Okay. So that leaves one more country to go. And that, of course, is the U.S. So let's come over here now. Let's just take a look at the U.S. numbers.